This is the second part of the assessment now, dealing with the lungs, the heart, and the abdomen, and we'll be performing this on a mannequin. Okay, so I've already done the introductions and whatnot at the beginning part of this. Now that I'm in here, basically what I want to do when I first start looking at it is make sure I see the chest is rising and falling equally on both sides, symmetrical. When I'm looking at them, I'm looking at the general skin color also. I will take and also just mash the little finger here, and you're looking for your capillary refill to make sure that it's less than 3 seconds. If it's less than 3 seconds, that's good perfusion, good circulation going through. If it's greater than 3 seconds, then there may be an issue with circulation. But we've actually looked at the general skin color. We see the chest is rising and falling equally on both sides. We don't see any swelling or edema in the hands or in the feet. Now what I'm going to do is ask him to turn over on his side, and I'm going to listen to his back. And what I want to do is make sure I listen to the posterior and the anterior breath sounds. Now with this right here, you definitely want to give privacy here. Okay, but you want to put your stethoscope in your ears. Again, make sure it's on the right side. And you want to go inside the scapula, and you want to place and listen. Have them take a slow, deep breath, and you listen on both sides, and stay inside the scapula as you're working your way down. Okay, so I'm listening from both sides, comparing the sides back and forth. When I get down to the base of the lungs or the edge of the rib cage, I want to go all the way around on the side, on both sides. The most important part here is that you're listening to both sides back and forth and comparing that we've got ventilation going on in both sides, all 5 lobes there. Okay, now on the front part, what I want to do, and again, I definitely would have privacy here, okay, is pull this up, and I want, again, to listen and start up here and go in between the intercostal spaces and listen to both sides and have them take slow, deep breaths. And just a word of caution, if they take too many slow, deep breaths, they can hyperventilate, so you want to be careful with that, okay? And I'm just listening as I go down, and he's taking good deep breaths. And again, from the front, you want to take and go, and each time go off to the side, also listening. Okay, now as I was listening here, I noticed the respirations were nice and equal. They're nice and easy, the pattern is, I don't see a lot of sign or a lot of or hear anything that's abnormal like rails or rhonchi or wheezes. The breath sounds are clear, bilaterally, both sides. The chest is symmetrical, the movement. Now what I want to do is listen to S1 and S2. Okay, if you listen to S1, you want to find the midclavicular is your collarbone. Okay, find midclavicular, which is usually in line with the nipple. Go in between and count down to your 5th intercostal space, and then midclavicular is where you're going to listen for your S1. Okay, you want to listen for a full minute with that if you're doing the apical pulse right here. Okay, I'm not going to do that right now, but you would listen here. Now for S2, you would come back over again, find the clavicle, the collarbone. Okay, come down to the 2nd intercostal space, and you would listen here for your S1. Okay, so you've got your lub, S1, your lub dub, the dub is S2. So S1 is going to be on the right side, intercostal space down. S1 is going to be down on the left side, 5th intercostal space down, midclavicular. Okay, now that I've done that, I don't hear any sounds other than S1 and S2 with the heart. Okay, I'm going to cover that part up and come down to the abdomen. And you want to cover them as much as you can. Okay, the first thing you want to do with the abdomen is to take and inspect, meaning I'm going to look and see, is everything I see on one side what I see on the other. I don't see any scars, any bulges, any dimpling, any bruising. Once you do that, then you want to auscultate next, and you want to auscultate all 4 quadrants. Okay? And that's where you're listening for the clicks and the gurgles. You've heard your stomach growling when you're hungry. That's a bowel sound. That's peristalsis. Okay? So now I will listen to all 4 quadrants. If I don't hear any bowel sounds, I have to listen 5 minutes per quadrant before I can say no bowel sounds. Okay? So let's go ahead and listen here. I hear bowel sounds, hear bowel sounds, hear bowel sounds, and hear the bowel sounds. Now, what you might want to do also is ask the patient if they're tender or if they hurt anywhere. If they do, gently massage, or I should say gently palpate, down and let loose and see if that makes the pain worse or better, or if you palpate any ridges. Okay. Now, the bowel sounds can be listed as absent after I've listened for 5 minutes per quadrant, or they can be active, hypoactive, or hyperactive. Once we finish with this part here, we've got the lungs, we've got the cardiac, and we've got the abdomen, and that will conclude your assessment. Okay? At this point, you would go ahead, put the head of the bed down or position them in a safe, comfortable manner that they want, put their call back, light back in reach, put their overbed table with whatever they want on the bed table, put the bed back down, explain to them anything that they might have questions about, and then you would go and document and you would compare to what you find, what the abnormals are.